comments. To get things started, I'll send it over to Dr. Hurley. Good morning, Dr. Hurley.
Good morning. Thank you for being here. So at this time, really all of our data sources are showing an increase in COVID-19 transmission in Colorado. This particular figure is showing you our case data. So in this figure, you can see that red line, which is showing you our 7-day moving average number of cases, which is now over 1,500 on average a day. And then each of those gray vertical bars shows you our daily case numbers. And if you go to the next slide, you can see a zoomed in version here. So you can see that we do see a little bit of day-to-day variability in the data, but overall, we do see this clear increasing trend in the number of cases that are occurring in Colorado right now. To put it in perspective, of course, though, we know that the numbers continue to be relatively low compared to what we've seen in previous waves, but of course, still have that upward trajectory right now. Next slide, please. Moving on to our percent positivity data, similar to our case data and other data sources like wastewater data, we continue to see a clear increasing trend here. So our wastewater data now about 8.7% positivity, and you can see that clear upward trajectory there as well. Next slide, please. Moving on to our hospitalization data, another place where we're seeing an increase in trends right now. We've seen a little bit more of a gradual increase here in hospitalization numbers compared to some of our other indicators, but we do see that clear increase up to 144 COVID-19 hospitalizations this week compared to 116 last week. So still seeing that clear increasing trend. Next slide, please. Moving on to what is really responsible for these increases that we're seeing right now. These increases are really being driven by Omicron subvariants, especially the BA 2.12.1 variant, which is increasingly becoming dominant here in Colorado and the US. We believe the reason for this variant becoming, or subvariant becoming dominant, is that it has an advantage over earlier types of Omicron in that we believe it's more transmissible, about 25% likely more transmissible than BA2. Right now, CDC nowcast modeling is estimating about 48% of what's circulating in the US is BA 2.12.1, and that's about 44% in Region 8, which is the region that includes Colorado. Our Colorado specific data is showing us about 40% right now. We have also had sporadic detections of BA4 and BA5 in the US and here in Colorado. We had our first detection of BA5 just this week. And we believe that these variants, which are circulating mostly at higher levels in South Africa and then also increasing in some European countries right now, are also probably more likely to be more transmissible than BA2 subvariants that have been circulating. And there's also some limited data suggesting that there could be a greater degree of immune escape associated with BA4 and BA5. There's a possibility that the same thing is true of BA 2.12.1, but the data is less clear there, and we have less clear information, and still lots of questions remaining about BA 2.12.1. And when I talk about immune escape, what I mean there is the ability for this virus to go on and infect someone who's been previously infected or someone who's vaccinated. So that ability for the virus to evade our immune system. Next slide, please. So looking specifically at our variant data here in Colorado, this is a figure that is up on our website. As I indicated, about 40% of what's circulating in Colorado is BA 2.12.1. On the far right end of this figure, that is shown in red. You can see other variants that are circulating in the state are BA2, and then also just a small amount of BA1 continues to circulate here in Colorado. You'll see that just in the last 2 weeks, we have seen the addition of BA4 and BA5. Again, those are the subvariants that have been circulating more widely in South Africa and certain European countries. Next slide, please. So moving on to talk about what we might expect over the next couple of weeks in Colorado. This is data that comes to us from our modeling team and shows us what we might expect to see as far as hospitalization numbers in the next couple of weeks. So in this figure, you can see our winter Omicron peak for perspective. And then as you move to the farther right end of this figure, you can see a range of potential outcomes associated with various characteristics as we're still trying to learn more about this BA 2.12.1 subvariant. There's this range of possibilities and the number of hospitalizations that we could potentially see over the coming weeks. But what you see in the data is that we expect that number of hospitalizations to near its peak probably sometime in mid-June. So we do have several weeks to go of increasing trends in cases and hospitalizations in the state. But you'll see that there is quite a range of possibilities here. The good news, of course, is that the range of possibilities that we see here for the number of hospitalizations does not get close to what we saw during the Omicron earlier surge this winter, but certainly could indicate some strain on our healthcare system, could make things tighter in our healthcare system, and our healthcare providers and our healthcare facilities could certainly feel some stress in the coming weeks. Also, as we start to see these levels of transmission get higher and higher, always important for individuals who are at higher risk to consider ways that they might be able to mitigate that risk for themselves. So things that individuals who are at higher risk or people who come in contact with them might want to consider doing in the coming weeks would be consider wearing masks when you're going to be around other people, especially indoor crowded environments. Also strategies like testing before or after gatherings. And then of course, social distancing continues to be an important strategy to decrease risk. And with that, I will hand it over to Director Bookman.
Thank you, Dr. Hurley, and thanks everybody for joining today. I only have one slide to talk with you about today, but it is around testing, which is an important tool in our toolbox as cases rise across the state. It is still important for Coloradans to understand that testing is a key strategy to keep individuals and our population safe. For people who are feeling ill, it is important that they test and isolate until their symptoms resolve or until their test results come in, or both. Also important for people who are using at-home tests to report them to us. And on the slide here is how people can report a positive Binax Now or iHealth test that they take at home. There are a number of ways for Coloradans to continue to have access to testing. The federal at-home testing program, where people can order tests and have them shipped directly to their home, has been expanded. People can now get 8 free rapid at-home tests shipped to them. And we really encourage people to do that, certainly before they become symptomatic. That way they have the tests available at home if they feel the need to test. Additionally, we have more than 80 community testing sites across the state and additional locations where people can go to pick up rapid tests within Colorado. That information is all available on our website. And testing is not just for people who are feeling symptomatic. It is also for people who have been exposed. It is also an important tool before gatherings. As we get into graduation season, it's a good opportunity to do testing before graduation parties. It's certainly a good tool to do testing before you visit with people who are vulnerable. And lots of testing resources continue to be available, and we want to encourage people to take advantage of those resources. With that, I will turn it over to Deputy Director Herrera.
Thank you, Director Buckman. So just a couple of days ago, the FDA authorized a 3rd dose of Pfizer's COVID-19 vaccine for kiddos aged 5 to 11 who are at least 5 months out from their 2nd dose. Pending a recommendation from the Advisory Committee on Immunization Practices and formal approval by the CDC director, our COVID-19 vaccine providers in the state could soon begin administering these 3rd doses to kiddos 5 to 11. So it'll be really important to receive those 3rd doses because this will offer better protection for kiddos in this age group as cases are trending upwards, as Dr. Herlihy was mentioning earlier. And this really holds true for all ages. Vaccination continues to be the best protection for everyone. So we really recommend people stay up to date on their vaccines so that they can have the best protection as cases are trending upwards. Anyone, regardless of their vaccination status, though, if they are experiencing symptoms, should get tested as soon as possible and isolate immediately while they're waiting for their test results. Let's go to the next slide, please. So anyone that does test positive or think they might have COVID-19, we really want to encourage them to seek out their healthcare provider and inquire about whether treatment might be right for them. It's really important for that treatment to be started within the first few days of symptoms in order for it to offer that best protection against those symptoms. We have many providers around the state that have doses on hand for treatment, and many of them offer testing and treatment in the same location. And we also want to remind folks that Coloradans that are moderately to severely immunocompromised, if they have been vaccinated and didn't mount an immune response, or maybe they can't be vaccinated because of a previous allergic reaction, there is also a preventative medicine called Evusheld that can offer protection. Providers across the state have all of these medications readily available. And so if you are symptomatic or think you might have COVID, we do encourage people to seek out their healthcare provider. On our website, if you don't have a healthcare provider, we have resources for other healthcare providers that are seeing patients that are not their own. And then in the coming days, we'll be offering new resources for providers that can offer telehealth services as well to also seek these treatments. Back to you. Thank you.
Thank you, Director Bookman, Dr. Herlihy, and Deputy Director Herrera. We'll open it up to the media Q&A portion of today's press conference. We'll use the raise hand function that's located along the bottom of your Zoom console. Let's start with first questions first. If we have time, we can come back for some second questions or follow-ups. Please state your name and outlet before asking your question. And if there's anything we haven't covered or that we aren't able to get to today, please email us at media_info@state.co.us, and we'll get some information to you as soon as possible. Let's go ahead and get things started with Seth.
Thanks, Seth and Lizette. Dr. Hurley, I imagine this is for you. How should we be taking the identification of BA4 and 5 in Colorado? What should the response to that be? Thanks.
Yeah, it's a great question. We don't really know at this point if BA4 and BA5 are going to have any sort of an advantage in spreading more rapidly than BA2.12.1 is. So I think lots of questions remain about whether BA4 and 5 are going to take off here, or if they're similar in transmissibility to BA 2.12.1, meaning that they wouldn't necessarily replace it. So I think lots of questions, unfortunately, we don't have answers.
All right, let's go to Vinny. Go ahead, Vinny.
Yeah, it's Vinny Del Giudice at Bloomberg News in Denver. Dr. Herlihy, a couple of questions. On the BA4 and BA5, that's a single patient, is that right? And were they hospitalized, and where was it located? And secondly, can you give the range of projected hospitalizations? Again, the low end, the high end, and the middle. Thank you very much.
Sure. So we've had one BA5 detection so far in Colorado and a handful of BA4 detections, and they are from multiple locations across the state. I don't have the specific details on those individual cases. I would also remind you that this data that we get from sequencing is not all cases in the state. Only a sample are going to be sequenced. We know, of course, that not everyone gets tested to begin with. So this isn't necessarily representative of every single case of BA4 or 5 that could potentially have occurred in the state. One thing that we are doing is adding BA4 and BA5 to our wastewater detection systems. And so we will have upcoming data about BA4 and BA5 in wastewater as well. The specific numbers for the range of hospitalizations in the scenarios, I want to say that range is about 500 to 800 or so. I don't have the exact numbers there.
All right, let's go to Chris Vanderveen.
Chris Vanderveen with 9 News. Does anyone think there's an inherent undercount in the case counts right now simply because of the testing structure that we have right now? It's a very different testing structure that we have in place now than we had, let's say, a year ago. So is there the possibility that we're undercounting cases right now?
Yes, absolutely. And I would add that we've actually been undercounting cases throughout the pandemic. At the beginning of the pandemic, when there was less testing available, we were certainly undercounting cases. We tended to count the most severe cases because those individuals were hospitalized, and that's where testing was being prioritized. As testing became more available, we were testing a large percentage of the population. And then, of course, at-home testing became available, which is important on its own and does provide individuals with information. So there's been, I think, some variability, But that is really why we continue to use multiple sources of information to understand whether we are seeing increases and decreases in cases and how high cases are now or transmission is now compared to previous times in the pandemic. And that's honestly one of the really important new uses of wastewater data, is trying to fill that gap. There's still quite a bit of work we need to do to refine our methods around wastewater surveillance. But I think it's an important new tool in our toolbox and is going to be important going forward.
All right, let's go to Meg Wingreter. Go ahead, Meg.
Hello, this is Meg from the Denver Post. When you mentioned the possibility of be some stress on the healthcare system, are you envisioning something like over the winter where it seemed like in the emergency rooms and kind of the front of the hospital was really taking the brunt that time? Or where are you thinking there could be kind of a pinch point? Thank you.
I don't know, Director Bookman, do you want to comment on that?
Sure. Thanks, Rachel. Meg, I'll try to answer your question the best I can. I think when we see increase in cases and increase in hospitalizations, we just tend to see a generalized stress on the system. We'll have, more need for testing. We're likely to see an increase in visits to our emergency rooms. We're likely to see an increase in admissions both to our floor beds and our ICU beds. But I think it's really important to note that this is predicted to be a significantly smaller peak than any previous peaks that we have seen, certainly compared to Omicron or Delta. And then obviously the other issue is potential impacts on absenteeism as our healthcare providers also get sick.
All right, let's go over to Zoe.
Hi, I'm Zoe Schacht with Colorado Newsline. I'm curious if you think that there's going to be any mask mandates returning with this increase.
So I'll take that one. Obviously, we have been at a point for quite some time here where, in Colorado, any mandates that have occurred have been at the local level. The state has been here to support our local public health agencies and giving them the information and the guidance they need to make the best decisions for their community. We will continue to monitor where we are and where we are headed and work with our local partners to help them make the best decisions for their communities.
Okay, let's send it over to John Ingold.
Hey, it's John Ingold from the Colorado Sun. Thanks for taking our questions. I'm wondering on hospitalizations, do we have a good sense of how many of those are incidental and how many of those are actually due to COVID?
We do, and we are actually going to be sharing some new data on this, if not today, then tomorrow. So very soon, we're going to be adding some additional data to our website to show that data regularly. At this point, it does look like about 60% of hospitalizations that are occurring in Colorado are among individuals that are hospitalized due to their COVID infection. So of the total number of hospital admissions right now for COVID-19, 60% due to COVID. And that's been, variable throughout the pandemic. We know that one of the things that influences that is going to be testing practices at hospitals. And so there's a lot of variability, I think, over time in what those numbers look like, but glad to share them more regularly.
All right, let's go to Adari Riara.
Hello, I'm Adari with Telemundo Denver. I have two questions. The first one would be, what are some recommended measures right now for the public, those who are safe, to continue being safe? And when it comes to at-home testing, do you guys know how long would it take for someone who requests the at-home testing today to receive them? Thank you.
I can take that first question. So, strategies that we would recommend now, and I would say strategies that are probably most important for individuals who are higher risk or people who, come into contact with higher risk individuals would be, things like social distancing, all the things that we've been doing since the beginning of the pandemic. Social distancing, wearing masks, especially in crowded indoor environments. And then, of course, testing before gathering with individuals, especially if you're going to be gathering with higher risk individuals, and then testing after a gathering if you're going to be having contact with high risk individuals. I would also add that, it's the season of graduations and lots of other celebrations and events. And, it might be that individuals want to take precautions to ensure that they don't miss those types of events. I have my daughter's graduation coming up. And so ensuring that I can be there and not miss that due to a COVID infection is important to me. And so I'm taking precautions, wearing a mask when I'm in public.
And then I'll answer the second question, Ryan. As far as how long is it taking for people to receive those tests, obviously this is a federal program, and so all of it is dependent on how the feds are administering it. We are hearing anecdotally that people are receiving their tests within several days of when they submit their order. And again, want to remind Coloradans that they can go to our website, find information on where they can pick up rapid tests in Colorado, and also where our community testing sites are.
All right, let's go to Sarah Flower.
Hi, Sarah Flower with KSUT Tribal Radio. Thanks for the update today. My question, I have two parts on vaccines today. One, is there any guesstimate on when children will be able to receive those boosters in the state, and any update on children under 5? Thank you.
Thank you for the question. So assuming that the ACIP recommends booster doses or third doses for 5 to 11-year-olds and the CDC director formally approves that, it could be as soon as a couple of days when providers can begin offering these doses. Based on our data, about 98,000 kids in this age group are at least 5 months out from their second dose and would be eligible. Based on our last data, there's about 150,000 doses across providers all across the state. So there's plenty of supply. And parents really shouldn't have an issue with being able to get those third doses for their kiddos. In terms of your second question, we are anxiously awaiting the feds to take action on vaccines for kiddos 4 and under. Governor Polis has sent a couple of letters to the federal government, really advocating for swift movement. What we are anticipating right now is early June is when the FDA will take up the issue of reviewing the data that the Moderna has submitted for kiddos 4 and under. If they make that authorize the Moderna vaccine for that age group, and then CDC does their piece and approves it, we could see distribution as early as the week of June 13th. So we are already reaching out to providers to understand their capacity to vaccinate this age group. Based on the number of providers who have been vaccinating the 5 to 11-year-old age group, that's around 1,000 or so providers across the state. We're anticipating a good chunk of them to also order vaccine for this age group and make it available. So about the middle of June is when we're anticipating Moderna. And for Pfizer in particular, we're really looking probably early July.
All right, let's send it over to Courtney Yoon.
Thanks, Courtney Yoon from 9 News. It sounds like there's an emphasis on at-home testing again, but it sounds like factories that are making these kits in the U.S. are starting to lay off workers and shutting down production lines. I'm wondering, is there any anticipation of a shortage of testing kits, and if the state is looking at alternative ways of getting resources now, or what our supply looks like?
Well, our current supply is strong. We have a stockpile on hand so that we have the ability to surge as needed. Obviously, there are a lot of federal factors at play here. And so we will continue to watch this landscape and really make sure that we have the necessary supplies on hand, both for rapid testing and again, also for those community testing sites. So we have the ability to surge in that space as well.
All right, let's go to John Daly.
Hi there, John Daly, CPR News. Thanks for taking our questions. Question about boosters. Do you have any data about Colorado COVID hospitalizations and how many of them are have their first 2 shots but are not boosted? In general, how do you think we're doing on the boosters, and what kind of things would you like to see to get those booster numbers higher in Colorado?
Take the data part of that question. So we do have a vaccine breakthrough dashboard on our website where you can look at the risk of being infected, the risk of hospitalization, and the risk of death among individuals who are unvaccinated, individuals who are vaccinated but have not received a booster, and then individuals who are fully up to date and have received that booster. So that information is available on our website at this point.
And then in terms of how we are doing overall, Colorado actually continues to do pretty well for boosters. We are 10th in the nation for people 12 and older. That's the age group that is currently eligible for boosters. And we are at around 55.7% of folks 12 and older who are eligible for a booster have gone on to get one. That outpaces the national average, and we are 10th in the nation. We continue to promote boosters as a means, best means to protect yourself against the worst outcomes of COVID-19. We still have all of our mobile vaccine buses going around the state and offering doses. We anticipate having that available for at least the next couple of months. And then we have about 2,000 vaccine providers that are still offering these doses. When we do finally get to doses available for the smaller age groups for 0 to 4, we are looking at hosting another series of clinics with Children's Hospital, particularly for this age group to offer those vaccines. But we will also be offering vaccines for the entire family. So anybody that hasn't gotten their primary doses or might need a booster, if they're bringing their small child in for vaccination for the first time, it will also be an opportunity to vaccinate any family member as well.
Mallory Anderson, go ahead.
Hi, Mallory Anderson from KRDO. Can you address the pandemic fatigue? Is there a fear that cases could get out of hand this summer or this fall, since many people have already had the virus and recovered, so they may not care if they get it again?
I think understandably, it's been a long 2+ years at this point. And we do know that people are getting tired of the virus. Unfortunately, that doesn't stop the virus from doing what it will do. We are here today to make sure that the public is aware of what is happening and where things may go from here. And we will continue to provide that information. We really want people to know what's happening so that they can keep themselves and their loved ones safe.
All right, we'll go ahead and take a few follow-ups. Go ahead, Chris Vanderveen.
Thanks for follow-up, and thanks for doing this. I think my question is more in the long term. We are now in a situation where it's clear that the vaccine, while effective, isn't 100% effective. It's also clear that we have variants that are emerging around the country that can potentially be very problematic. What's the long-term goal here, minus just letting the virus do what the virus is going to do? Are states talking about not just in the next couple of months, but the next couple of years while we sort of move into this, whether you call it endemic or not, this new phase where people are tired of it and yet it's still around? So what's the long-term goal here?
Well, maybe I'll take a first shot at that answer, Chris, and then if Diana or Rachel want to add in anything. Yeah, I mean, this virus is here to stay. There's no doubt about that. We have seen it generally evolve to something that is, maybe more transmissible, but less severe overall. And so, we have learned how to live with the influenza virus, right? And every season, we have a vaccine that is tuned to what we predict to be the predominant strains. We do our best to ensure that those who are most vulnerable get that vaccine. And I think we're at a point now where we have to start looking at COVID in a very similar way. This is a virus that is going to be with us for a significant period of time. And it will go up and it will go down. We are going to need the public to understand that. We are going to need people to get their boosters when the time is right. And there will be times that we will recommend that, people either vulnerable or more broadly will be recommended to wear masks and maybe to be a little bit more careful. And I do think that rapid at-home tests are going to become part of our life. This virus is here to stay, and this is how we're going to live with it.
All right, let's go back to Vinny.
Thank you. Vinny Dalchudice at Bloomberg News in Denver again. Dr. Herlihy, you say 40% of the current cases are BA2 12.1. What are the others? Is Omicron still out there, for example? Thank you very much.
Yeah, so just about everything that is circulating in Colorado right now, in fact, maybe everything that is circulating in Colorado right now is Omicron. When we talk about BA this and that, what we are talking about are Omicron subvariants. So the most predominant subvariant of Omicron right now is the BA 2.12.1. So that is the one that represents about 40%. We still see a small amount of BA2, a small amount of BA1, and then new to show up in just the last couple of weeks are these BA4 and BA5 subvariants, but all of them are Omicron variants.
All right, let's go to Seth.
Thanks. Dr. Hurley, is there any reason to believe that BA4, BA5, or BA 2.12.1 cause any more severe disease than the initial Omicron strain or any previous dominant variants?
Yeah, there is some emerging data that there does not appear to be any increase in severity associated with these newer subvariants. So that is certainly good news and is something that we are keeping a close eye on. The modeling work that I did show you, if you remember that the figure I showed had a range of possibilities. There were these dark lines and then these lighter colored lines. And what the modeling team did there is slightly vary severity in case there is the possibility that newer variants do have an increased or decreased level of severity. And so that range of possibilities does account for a slight increase in severity. But at this point, we don't believe there is increased severity associated with these new subvariants.
All right, thank you. I want to thank Director Bookman, Dr. Herlihy, and Deputy Director Herrero for joining us this morning, and thank you all for joining as well. If you have any follow-up questions for us, please email at media_info@state.co.us. Hope you have a great rest of the day.